Your baby is crying. They're 6 months old and their gums are swollen because their first teeth are coming in. You take them to the doctor, and the doctor hands you a small tin of white powder. The label says it contains mercury. You're supposed to rub it on your baby's gums several times a day until the teeth come through. This was normal. This was what parents did. For over 100 years, mercury was one of the most common treatments for teething pain, and it wasn't hidden or downplayed. The manufacturers put the word mercury right on the label, sometimes listing it as calomel, which is mercury chloride. Doctors recommended specific brands. Mothers passed the tin around at church, at parks, to friends whose babies were also teething. Nobody questioned it. The powder came in small tins that you could fit in a purse or diaper bag. The most famous brand was Steedman's soothing powders, which sold 7 million tins a year in northern England alone. 7 million. Every year. There were other brands too. Steedman's teething powders, which was basically a copycat version with a slightly different spelling. Dr. Moffat's, Homocea. Some came in decorative tins with pictures of happy babies on them. Some had elegant script and Victorian flourishes. They were designed to look trustworthy, medicinal, safe. Inside was a fine white or grayish powder. You'd put a little bit on your finger and rub it directly onto your baby's inflamed gums. Some versions came mixed with chalk or sugar to make the taste more pleasant. The instructions were simple. Apply to the gums as needed for relief. And parents did. 4 times a day, 5 times, 6 times, because babies teethed for months and the pain kept coming back. It worked. That's the thing nobody talks about. The baby would stop crying. Their gums would go numb. Within minutes, a screaming infant would transform into a quiet, peaceful child. Sometimes they'd fall asleep right there in your arms. If you were a parent in 1910, watching your child suffer through teething pain and someone handed you a powder that made the crying stop in 5 minutes, of course you'd use it. Of course you'd tell other parents about it. Why wouldn't you? These powders were sold over the counter at any pharmacy. You didn't need a prescription. You didn't need to explain what you needed it for. You just walked in and asked for teething powder and they handed it to you, the same way they'd hand you baby aspirin today. Drugstore clerks would recommend their favorite brands. Some pharmacists mixed their own versions and sold them in plain tins with handwritten labels. It was that common, that ordinary. Mothers kept the tin on the nightstand next to the bed. When the baby woke up crying at 2 in the morning, you didn't have to get up and go to another room. You just reached over in the dark, opened the tin, rubbed the powder on the baby's gums with your finger, and everyone went back to sleep. It became part of the nighttime routine. Bath, feeding, teething powder, bed, as automatic as changing a diaper. And some babies needed it more than others. Some babies teethed harder, cried more, seemed to be in worse pain. Those babies got the powder more often, several times a day, every day, for weeks, for months. Their mothers were doing what any good mother would do. They were easing their child's suffering. They were following the instructions on the tin. But then something would start to happen to some of these babies. Not all of them. That's important. Most babies who used the powder seemed fine, but about 1 in 500 babies who were exposed to these mercury powders started developing strange symptoms. And at first, nobody connected it to the teething powder. The baby would become very quiet, not in a peaceful way, but in a listless, limp way. They'd lose muscle tone and lie there in what doctors described as a frog-like position, their arms and legs splayed out, unable to hold themselves up properly. They'd stop eating as much. They'd seem weak, irritable, miserable. Their skin would get pale, and then their hands and feet would start to turn pink. Not a healthy pink. A dusky, strange pink, like their skin was inflamed from the inside out. The babies would sweat excessively, even when they weren't hot. They'd become sensitive to light, turning their faces away from windows, crying when you took them outside. Their hands and feet would swell up, and then the skin would start to peel away in sheets. Some babies would lose their teeth, even baby teeth that had just barely come in. Some would drool constantly because they were producing too much saliva. Some would develop digestive problems, diarrhea that wouldn't stop, vomiting. And these babies were in pain, real pain. They'd cry when you touched their hands or feet. They'd pull away from being held. They'd have trouble sleeping, but they were also too weak to stay fully awake. They'd just exist in this miserable in-between state, irritable and exhausted and uncomfortable. Mothers would take these babies to the doctor, terrified that something was seriously wrong. And most doctors didn't make the connection to the teething powder. They'd diagnose the baby with a stomach ailment, with a fever, with some childhood illness that was going around. They had a name for it: pink disease. Because of the way the baby's hands and feet turned that strange, dusky pink color, it became a recognized medical condition. Doctors published papers about it, wrote about the symptoms in medical textbooks, tried to figure out what was causing it. Some thought it was a virus. Some thought it was a nutritional deficiency, maybe a lack of vitamin B. Some thought it was just one of those mysterious childhood illnesses that appeared and disappeared without explanation. And while they were theorizing, they'd tell the mother to keep doing what she was doing, which included giving the baby the teething powder, because at least that kept the baby calm. The disease had other names too. Acrodynia, which comes from Greek words meaning pain in the extremities. Swift's disease. Fear's disease, named after a Swiss doctor who documented cases in children's hospitals. But nobody called it mercury poisoning, not yet. Between 10 and 33% of babies who developed pink disease died from it. Not all of them, but enough. Their little bodies would just shut down, overwhelmed by the mercury accumulating in their systems. And when they died, the death certificates would list the cause as pink disease, or sometimes just as teething, because there was a widespread belief that teething itself could kill babies. In London in 1842, almost 5% of all infant deaths and over 7% of toddler deaths were officially attributed to teething, as if the act of teeth coming through gums could somehow be fatal. But it wasn't the teething that was killing them. It was the treatment. It took decades for doctors to figure this out. The first real breakthrough came in 1947 at the International Congress of Pediatrics in New York, when a Swiss doctor named Fanconi and an American doctor named Warkany started comparing notes. Warkany had been suspicious of teething powders and had tested the urine of babies with pink disease. He found abnormally high levels of mercury, not in every baby, but in most of them. 92% of the babies he tested who had pink disease showed elevated mercury levels in their urine, compared to only 15% of healthy babies. In 1948, both doctors published their findings. Mercury was causing pink disease. The teething powders were poisoning babies. But even then, it didn't stop immediately. Some doctors resisted the findings. Some manufacturers defended their products. Some parents didn't believe it because they'd used the same powder with their first child. And that child had been fine. And that was true. Most babies who used the powder didn't develop pink disease. It seemed to depend on individual sensitivity to mercury, on how much was used, on factors nobody fully understood. Regulations came slowly. The UK started restricting mercury in teething powders in the late 1940s, but didn't fully ban it until 1954. The United States took similar steps around the same time. Some countries moved faster, some slower. But even after the ban, some old tins of powder stayed in medicine cabinets. Some pharmacies still had stock they needed to sell through. Some families had leftover powder they'd bought in bulk and kept using because it worked, and they didn't know. A mother in 1955 might have opened her medicine cabinet and found a tin of Steedman's soothing powders that she'd bought 2 years earlier, and she might have used it on her teething baby, not knowing that the medical consensus had shifted, not knowing that the product she trusted was now understood to be dangerous. And all those babies who survived pink disease, what happened to them? Most seemed to recover. That's what doctors said at the time, complete recovery. But when researchers followed up decades later, they found that many of these survivors had ongoing health problems, higher rates of certain conditions, neurological issues. Nobody knows exactly what the long-term effects were because nobody was tracking it carefully enough at the time. Millions of babies were exposed to these powders. Millions. 7 million tins sold per year in just one region of England, and that's just one brand. Most of those babies turned out fine, or at least they seemed fine, but 1 in 500 didn't. And even for the ones who seem fine, we don't really know what low-level mercury exposure did to their developing brains and bodies over the course of their lives. The parents who gave their babies these powders weren't being neglectful. They weren't being careless. They were doing exactly what they were supposed to do. They were listening to doctors. They were following the instructions on the label. They were using a product that was legal, regulated, widely available, and socially accepted. They were trying to comfort their suffering child. That's the part that should bother you. Because it wasn't a scandal, it wasn't some fringe practice or dangerous folk remedy. It was standard medical care. The fact that it was mercury didn't raise red flags because mercury was in everything back then. It was in laxatives, in treatments for syphilis, in antiseptics. It was considered medicine. The idea that medicine could be the problem didn't make sense to people. There are pictures of these tins in medical museums now. Small, decorative containers with Victorian lettering. The brand names in elegant script. Sometimes a picture of a peaceful baby or a mother holding her child. Sometimes there's a small placard next to the display explaining what the powder was, when it was used, what it caused, and people walk by and stop and stare and take pictures because there's something almost impossible to process about it. The idea that this was medicine, that this was normal, that this was what you gave your children. Dash, dash, dash. Now here's the uncomfortable part that nobody really wants to think about. Teething still hurts babies. Babies still scream for months while their teeth come in, and parents still desperately want something, anything, to make it stop. We still rub things on their gums. We still give them medicine to swallow. We just use different substances now, different brand names, different reassurances. In 2018, the FDA finally warned against using teething gels that contain benzocaine because they can cause a life-threatening condition that reduces oxygen in the blood. These gels had been sold for decades. Parents had been using them for decades. And in 2018, suddenly, they were dangerous. How many babies were exposed before someone figured that out? The teething powders you can buy today, the ones marketed as natural or homeopathic, some of those have been pulled from shelves too. Not all of them. Some are probably fine. But which ones? How do you know? Maybe in another 100 years, someone will make a video about the things we did to our babies in 2025. The things we rubbed on their gums, the plastics we let them chew on, the chemicals we thought were safe. Maybe they'll look at our medicine cabinets the way we look at those mercury tins. Maybe they'll say, how did nobody see this coming? How were parents just okay with this? Or maybe we finally got it right this time. Maybe we learned from the mercury and the benzocaine and all the other mistakes. Maybe the things we're using now are actually safe, and our great-grandchildren won't look back in horror. But I wouldn't bet on it.